Are you looking to plan long-term care for either yourself or a loved one? Arvette M. Reid has over 15 years of experience as a marketing professional in both senior housing and healthcare, and she's passionate about helping families bridge the gap between care and finance. In the first part of our interview, we discussed the factors and options that go into planning long-term care. You can find a link to that portion of the interview here in the description below. In the conclusion of this interview, we'll hone in on home care, discussing both its costs and the many different ways to pay for it. Big question, but broadly speaking, how much does home care cost compared to inpatient communities?
Oh yeah, we get this question a lot. So
Yeah.
home care, I know. If you look at like the actuarial tables, Genworth actually says home care is about $5,000 a month.
Yes.
And that's an average of, they say, of 6 hours a day. The issue with that is when you're looking at home care services, the number of hours can vary dramatically based on how much help you have, right?
Yes.
And also, maybe not all of those hours are paid hours. So remember, you still have a companion that might be able to help. You still might have neighbors that might be able to help. You still may be able to get some resources from the senior center or something like that, or Shepherd Center. Sometimes they provide free transportation and things like that. So sometimes there's services that you actually don't have to pay for that can help during that time. But if a lot of places here will have a 4-hour minimum per day.
Yep.
And then it can go all the way up to 24 hours, which could be 3 caregivers around the clock. And if you're doing that, you're looking upwards of like $250,000 a year, right? So the idea of living at home, people don't realize that that's great, but you're going to have to make sure you're safe at home. And if you need 24-hour care, it could be that. There also is the live-in option where I can have somebody live in, and that tends to be a little less expensive, but someone else needs to be responsible when that live-in is sleeping and on their breaks.
Yes.
Right. So I like to remind everybody of that.
And so what sort of financial assistance is available for home care?
Yeah, so financial assistance, let's define that a little bit. So from a how do I pay for home care, there's different buckets that I say you can pull the money from. The first thing I want to clarify is that Medicare, so remember, Medicare is a federal benefit that some people qualify for. Not everybody, but most people qualify for Medicare. Medicare will cover what they call home health. There is a difference between home health and home care.
Yes.
Home health is tied to a hospital stay, usually tied to some kind of rehab need, rehabilitation need. So if you're in the hospital for 3 nights and you need to come home and maybe having physical therapy, occupational therapy, have an aide maybe help you in the morning, that would be covered by your Medicare for a short amount of time. That's completely different than what we're talking about home care services. So most home care services are private pay out of pocket. So you are paying for these services. Now, there's a couple of other options. One is Medicaid. So I defined Medicare as a federal benefit that people can get. Medicaid is a state benefit and it is based on financial aid. So you actually have to apply for Medicaid if you qualify. And it's got multiple qualification factors. It has a income factor, a health factor, as well as a resource factor. So you can research that. But even if you are Medicaid qualified, you could get aid in the house paid by Medicaid, which is great. But they're also going to assess how many hours they're going to be there. You're not going to get Medicaid 24 hours a day. You're going to be looking for the family and everybody else to pitch in. So that's one way to get some financial assistance in paying. Second is veterans benefits. Sometimes there's veteran benefits for that. And then also, once again, utilize the free services in your area. As long as you're looking companion care, not aid care, use your local senior centers, area agency on aging, stuff like that, because sometimes you can get some help.
And a question I get asked a lot is, can family members get paid somehow to care for their loved ones?
So we have families that'll say, I would like to give my daughter or my niece a salary for helping me in the home. So yes, that's still out of pocket. You can give them a salary. In some cases, you can say, I'll give them free rent. Like we had a client whose niece was in college, but lived in the basement apartment.
Yeah.
And so they didn't charge the niece room and board, but the niece was responsible for housekeeping and shopping and a lot of things that the senior just couldn't get out and do anymore. And so that was their arrangement, right? But if you need caregiving services, help with the 580Ls,
Yes.
if you have long-term care insurance, which will pay for part of it, long-term care insurance wants a licensed professional, right? So that's always the trick question. Can my loved one get paid to help me? Yes, with the caveat of not with long-term care insurance in most cases, unless they are a licensed professional.
Yeah. So essentially you're the one paying them.
Yeah.
Are there any cases when Medicaid can be used for that?
I don't think so. I think it's the same thing where you have to be a licensed professional.
Yeah.
So I'm pretty sure Medicaid would require you to be a licensed professional, but there are people who get their license and then they register with there's online registries like
Yes.
homecare.com, and then the local franchises sometimes will let you connect with them. So there is a way, if you have gone through the classes and you have the certification, to associate yourself with a professional organization. Then they take on the insurance and all the liability, and you can still get paid that way.
Okay, good to know.
Yeah. And we talk a little bit about long-term care insurance. I love long-term care insurance, right? It's great.
Yes.
But I also want to let you know, long-term care insurance is not going to pay for everything. So you need to make sure that you are looking at all these underfunding sources. You've got Social Security coming in, you might have a pension coming in, you might have some investments, you might be able to use part of your house, whatever it is. Pull all the different pieces together and make your bundle of how you're going to pay that monthly fee and get that cash flow moving.
Are there any big things that you feel people overlook with long-term care insurance? Like they were thinking, oh, I was expecting long-term care insurance to cover this aspect, and it does not. Now I have to figure out that gap.
Yeah, you know what? Every policy is every policy. Like you need to pull that policy out, you need to dust it off, and you need to read through it and read through it right now where you understand before you need it. Because sometimes it covers home care, sometimes it doesn't. Sometimes the rate that they give you from home care is different than the rate that they would give you if you were moving into an assisted living, right?
Yeah.
Some of them have waiting periods of 90 days. Some of them have waiting periods of 30 days. Like, so there's lots of nuances to each contract. So definitely pull it out and look at it and read through it. And the other thing I say, like, when it's time to use it, if you meet the requirement to put the claim in, we tell people put the claim in. So some long-term care insurance policies will have like a lifetime, but some of them have a 3-year policy.
Yes.
And people are like, oh, well, I'm just starting to get sick or need help, so I'm going to wait, right? No. Like, that's why you got the policy. As soon as you can put that claim in, put it in. Don't wait. Nobody knows what's going to happen, right? Start drawing down on that claim right then.
Okay. And moving away from long-term care insurance a bit, a lot of people tend to go with the private caregiver route. I know I have a little bit of experience with my family doing that.
Right.
What are some of the benefits and drawbacks of that method?
Yeah, it's a good question. So if you have, and you can say private is non-family member, right? So we talked about the family member space, but let's talk about a private, like, hey, just pay me this dollar amount. The pros is usually it's a little cheaper than if you have to go through an agency or something like that.
Definitely.
Here are some of the cons. Number one, who's their backup? So if you have home care and you need somebody to help you dress or help you bathe or help you do whatever, when that person calls out or can't be there or goes on vacation, what's the backup? So when you have a private, you don't necessarily have a natural backup. When you have an agency, it's their responsibility to fill that slot if that person is off.
Yes.
Right? The other thing is we just like to make sure from an insurance perspective that you're covered, so that if you hire a caregiver through an agency, they are the ones that take on all the insurance. If you hire somebody on your own, usually we like to make sure that you look at your umbrella policy for your house, because if that person falls or hurts themselves or anything like that, like, they now can sue you because there is no company that's over top of them. So
yes.
I'm not deterring you from private caregivers. There are great private caregivers out there that families know and love. And like, families say, oh, this person takes care of my dad. Let me, hey, Ann, this person would be good for your mom. Great reputation, wonderful caregiver, but just make sure you're thinking about those other little pieces of the puzzle.
Yeah. And I actually had an experience with my grandmother. We had a private caregiver for her, filled in when one of us couldn't be around, and then COVID happened. And
And then they didn't come.
And they didn't come, and then we had to get tests in the house, and at a time when tests weren't available, and it was a whole hoopla, as you can imagine.
Yeah. And you know what? People's lives change. So, that private caregiver might be great, but something's going to happen in their life where they might have to take off. And so you just need to make sure you have a backup plan, right? Just always have a backup plan.
Yeah, I feel like that's a common thread of all these questions. Have a backup.
Backup. And places like homecare.com, for example, and there's a bunch of ones, but people like private one because they think it's cheaper, but also they get to pick their person. That's another reason people like private versus agency. If you go to some of those registries, you can interview people. So even though they're still through their registry, you get that feeling of, oh, this is the person I want. This is the person I like. So that might be a good kind of in between to going out on your own and going with a larger franchise.
As I'm sure you know, rapport is so important. Like if
Very
they're
important.
Technical skills aside, if they fit with the one who needs care.
Yeah, because whoever the person is that is needing care, they're not happy. Nobody wants to have a stranger in their home, right?
Yeah.
So it has to be a situation where everybody feels comfortable, because you don't want your loved one every day being all tense because the person that is there just they don't get along. It's not what you want. It's not what you want your loved one. For your loved one.
No, doesn't end well.
No, it's not good for anybody. It's too stressful.
So I have a little hypothetical for you. So if someone has not planned care in advance, regardless of their age, let's say they have an event like a fall, or maybe they start wandering, you start noticing the early signs of dementia or related illness. Where should they begin? Sort of like if they need care at need.
Yeah. Everywhere around the country, I guarantee you is a network of senior focused professionals that are already working. Like Ryan, the fact that you do these and you put the information out there and someone could just go online and Google and find you and learn.
Yeah.
So the instant you find yourself in a situation, ask for help, because if the person you first go to doesn't know, I guarantee you they know somebody else that knows, right?
Yes.
It's usually a very tight network. Don't be afraid to ask for help. Don't feel like someone's going to push you or sell you something that you don't need, right? And then if you end up in a hospital, they're going to give you a list. Everybody knows about the hospital discharge. So if you end up in an emergency in the hospital and they think you can't go home, you're going to get the list of places that you can go. Another good reason why you're still aware and alert, go look at the places around. So if you ever find yourself in an emergency, you can know what, I went to that place, and that place. Can I go one of those for rehab, right? So that's a little pre-work that you can do. And I'm going to sell again about that aging life care professional, the consultants of the industry is what I call them. When families find themselves thrust into the healthcare world, and you can imagine it's mom, dad, and maybe 5 kids, and everybody has their own opinion about what dad needs or doesn't need, right? Sometimes having a third party to help navigate that family circumstance is very, very helpful. So starting with like an aging life care professional where there's no long-term commitment, it's not like you're moving, right? Mm-hmm. But having somebody else come in, do a home assessment, do a care assessment, some kind of like conversation with the family member to give the family a document to all look at together and start on the same page would be very valuable. And they will be able to point you in the right direction as far as where within the industry might be the best place as a next step.
And can you usually find these aging consultants? Would you find them through an area agency on aging, or is there somewhere else?
Yeah, you can find them through an area agency on aging. There's a whole association, Aging Life Care Professional. I don't know what the association's called, but you can look them up there and they're everywhere. But I'm glad you brought that up again. Don't discount your local resources at senior centers, local area agency on aging. They know this space. They know the people that work in this space. So definitely utilize that. And also ask your friends and your family, because I guarantee you somebody you know had a loved one that went through something similar.
Yes.
Everybody's experience is going to be different, right? Like you can take 2 people and send them into the exact same company, situation, whatever, and they might have 2 different experiences. So just make sure you get multiple input.
Thank you so much for talking with me, Arvette. I really appreciate it.
No, I appreciate it. Thank you for inviting me.
Oh, thank you so much. Well, you have a great day.
You too. Bye-bye.